So there are many risk factors for a heart cardiac event. We want to know how we can improve our risk factors. So there are some things that we're able to change and some that we're unable to change. So pleasantly, the list of things that are able to change is quite a bit longer. So the things we can change are how much fat we consume, whether we choose to smoke, how much alcohol we drink, how much physical activity we do, our weight, our blood sugar control, particularly if we have diabetes, high cholesterol, our blood pressure, so we don't want our blood pressure to be high, stress and depression, and interestingly, type A personality. So what a type A personality is, and I'm sure everybody's met one before, is that person that's always highly wound up, highly strung. So you're trying to talk to them and they're sort of hurrying you along and they rush everywhere and that they always seem to be quite stressed. And interestingly, that's actually a risk factor for our heart as well. The things we're unable to change are our age, whether we've had an event or not, the presence of diabetes, our genetic predisposition, and the presence of menopause as well. So there are a lot of things that we can work on. So what am I here talking to you about? Well, diet, and that's because it is very important. So the good news is that healthy eating can help us reduce our risk of heart disease through our blood lipids, our weight, our control of our blood sugar levels and our blood pressure as well, and all of these things can help to decrease our risk of a heart event. Healthy eating can help us protect our heart, which is what we want. People often ask me, and it's funny, a human trait is seemingly wanting something in a nutshell quite quickly. So people say to me, what can I do to protect my heart? And it's almost like they want a one-word answer sort of thing. But you wouldn't go up to your financial advisor and say, how can I make $1 million? But I've only got a few minutes, just tell me now, sort of thing. So although the reason that this presentation will be so all-encompassing is because there are a lot of different things you can do to help protect your heart and reduce your risk of future cardiac events. But if I were to have to put it in a nutshell, it would be to minimise our dietary saturated fat and replace it with more healthy fats, which I'll explain as we go along. Increasing our fruits and vegetables. So most people actually don't eat enough fruits and vegetables. People think, oh yes, I eat veggies, almost every day. But when we actually look down into the studies at how much people eat, we would be wanting them to eat more. So that's always quite an easy one to improve on immediately. Increasing our fibre intake and also eating more essential omega-3 fatty acids. So these are our fish oils and that type of thing. There's your nutshell. So I'll go on to explain. What is a healthy diet? Well, it depends who you are really. If we're talking about a patient who's severely malnourished, such as one we'd see in a hospital, a cancer patient, for instance, then a healthy diet for them is more ice cream and chips and chocolate and lollies and cakes and biscuits, and you're educating a patient and they're utterly horrified at this. But the priority for that person is for very fast weight gain, because otherwise the malnutrition and the effects of that can kill them faster than the long-term effects of heart disease. However, what we're going to be talking about today is for patients who are fit, healthy. They may have diabetes, they may be overweight, they may have heart disease. So this diet really is suitable if you are healthy for yourself and your whole family, and reducing the risk of those conditions as well. So a healthy balanced diet doesn't exclude any of the food groups. So we do have 5 food groups, and I'll go through those in a minute, but it's part of your lifestyle and not just a short-term regime. So everybody loves a quick fix, particularly when it comes to weight loss. However, there is no quick fix, and the cold, hard, boring facts are it is eating less in terms of calories than you're actually expending if you wanted to move your weight in a downwards fashion. So things like the lemon detox diet or the grapefruit diet or the new coconut water, there's all sorts of different things, and you've got to realise that people are actually trying to make money from these. So they're trying to sell a product, and they do a damn good job doing it sometimes because they can be very convincing. But underneath all of that, what we do need to realise is you don't need to spend a lot of money on pills or powders or something to sprinkle on your arm that makes the fat melt off from underneath. It really is about balance and variety. And us dietitians do bang on about balance and variety, but that's why it's important, because For each of the 5 food groups, each food group provides a unique set of nutrients. So as soon as you start cutting out a food group, often you hear alternative health practitioners, ask you to cut out wheat or cut out dairy. There's a few common myths, one that milk causes mucus, and there's no evidence of that we know of. And wheat, our complex, heavy whole grain, wholemeal breads and cereals are very healthy for us. They provide a good source of fibre and vitamins and minerals, so we don't want to be cutting out any of the food groups. So basically the 5 different food groups are your breads, cereals, rice, pasta and noodles group, and the nutrients that provides, mainly your fibre, as I said, but your folates and B vitamins like your thiamine, and also a bit of iron. So there are best choices in each category. The best choice in this category are the ones with added fibre, and we'll talk about breads shortly, and also your heavy wholemeal, whole grain varieties. So then moving on to vegetables and legumes are part of that group because they do provide the vitamins, minerals, they're high in dietary fibre and carbohydrates. Legumes actually provide a bit of protein as well. It's good quality protein, so that's an added bonus. So we'll talk again about vegetables and legumes shortly, but in a nutshell again, we want to leave the skins on for that extra fibre, and we want to make sure that we choose a different variety of colours of our fruits and vegetables because, again, each of those colours provides a different nutrient and antioxidant. With your fruit, the main nutrient it provides is vitamin C, but a bit of fibre and carbohydrate as well. And again, we want to leave the skins on for that added fibre. Then we come to the milk, yoghurt and cheese, which is commonly referred to as your dairy group, but also includes alternatives as well, so your soy products and things. And the main nutrients that this group provides is your calcium, and I'm sure you're all thinking that as we were going along. Protein, and also your B12 and some riboflavin. What you want to choose from this group are your skim products because we'll talk about saturated fat soon, but skim dairy products are the lowest in saturated fat. And remember me saying that was one of the main things you can do to reduce your risk of a cardiac event. And then we've got your meat, fish, poultry, eggs, nuts and legumes group as well. So this mainly provides protein, iron, also your zinc and a bit of B12 too. So your red meats are the best sources of iron and zinc. So for this group, the main thing is reducing the fat in that because the fat that's attached to meat, so animal products, is high in saturated fat as well, so that artery blocking fat. So we want to try and remove the skin from chicken, we want to trim off the fat off your fatty meat, so things like bacon and chops. And I know what you're all thinking, oh, come on, that's the best part. Well, the best part is living, and this is what we're aiming for here, so keep that in mind. And if you can possibly remove the chicken skin and the fat from the bacon and things before you cook it, because it doesn't give the fat a chance to melt into the actual meat itself. Does that make sense? Hopefully. All right. So you also want to, as part of that group, choose fish twice a week. So your fatty, oily fishes, so there's the ones that swim deep at the bottom of the ocean, we'll talk about that soon, are higher in that omega-3 fat that we were talking about that's quite cardioprotective. And of course we want to avoid battered things. So I don't want to be the fun police here. So what I try and give you is all of the information, everything we know to this point, and what your job is to do is to think about what parts of that you can incorporate into your life. So 1 or 2 things at a time, adding them in each week, and building towards a healthier, more balanced diet. The information I'm providing is also suitable for patients with diabetes. So it can be quite confusing with diabetes because you think, well, I've got diabetes and I've got heart disease, or I have neither, or I have both, and you're trying to sort of figure out which diet is best. And I'll make it easy for you. A diabetic diet nowadays is just a healthy, balanced diet. So quite a number of years ago, before we knew a lot about insulin and what the pancreas does and how these hormones react in the body with our food, it used to be called sugar diabetes, and they used to think that a reduction in sugar was the best way to manage the condition. And although that's a small part of the story, it's not the whole picture. We now know that patients with diabetes benefit also from that lowering that saturated fat, which we'll talk about soon, because they're more prone to the arteries and blood vessels blocking up. So in terms of a healthy, balanced diet, for a diabetic patient, it's the same as for everybody else. So Just quickly, while we're on that, we'll talk a little bit about the glycemic index. So the glycemic index is a measure of how quickly or how slowly a carbohydrate food, so specifically carbohydrate, is broken down and released into our bloodstream as sugar. So we've got some foods, and I'm sure you've seen it before, high GI, low GI, and you think, oh, you know, which one's the best for me? There's also a low GI diet that's recently came out. But again, there's a few flaws in that, in just relying on the GI to guide you for your healthy eating. What it is basically is the lower GI foods are digested and broken down in the body more slowly than the high GI foods. So if we're giving you a couple of examples, you think about white bread. It's quite fluffy, it's a bit like fairy floss really, and when it goes into the body, it doesn't have much fibre, it's got nothing to slow it down. So it's broken down and released into the bloodstream quite quickly, and you get quite a surge of blood sugar. At the same time, insulin's released and it's sucked out of the bloodstream into the tissues quite quickly, and then you get that big dip. And so, you know, you sort of come down, it almost goes a little bit lower than ideal. So I guess that's what they call it, 3 p.m.itis. Often, has anybody had a big bowl of pasta before, and then, you know, sort of towards the afternoon, you're sitting at your desk and you're just thinking, oh goodness, I'm exhausted. Why am I so tired all of a sudden? Think back, what did you have for lunch? Was it a sort of slowly released carbohydrate or something that was a bit faster? So a lower GI food is digested and broken down slowly. So comparing white bread to something like whole grain or wholemeal bread, where the body has to work a little bit harder. So you might remember, I don't know if they still make them anymore, but those little slow release fertiliser pellets, and you put them in your pot plants. And every now and then one pops and releases a bit of fertiliser into the plant. So a little bit here and there means that you get it sort of a more even release. And that's similar to your heavy wholemeal whole grain breads. So when your white bread does that big spike and then drop, what your whole grain bread's doing is working quite slowly throughout the afternoon to keep you fuller and satisfied for longer, which is good for people who are trying to lose weight too. But the catch, just because something's low GI doesn't mean that it's the best item for you. So I wonder whether you can think of a low GI food that's less healthy. The one that comes to my mind is chocolate. So what happens is chocolate, the fat slows down your gastric emptying, and it also slows down the digestion and absorption of your food. So chocolate's actually low GI because it's digested slowly. Doesn't mean it's good for us. We'll talk about chocolate soon. On the flip side, a high GI food is watermelon, very quickly digested and absorbed. So watermelon's not bad for us, it just breaks down quite quickly and goes away again. So, you know, if we have diabetes, it's not that we can't have watermelon, it's that you wouldn't want to eat a whole watermelon. You might have a little bit in the context of a fruit salad or a healthy balanced diet. So that's GI, hopefully that's answered your questions about that. So another question we often get to about this point is, well, what if I'm vegetarian? So there are different types of vegetarians, and you can skip this little bit if you're not. But basically, some eat chicken and fish, some eat no meat at all, and some also avoid things like dairy products, and some even avoid honey, and those ones tend to be called vegan. So the advantages of being a vegetarian, there's a lot of controversy around about, you know, is a vegetarian diet healthier? Well, the benefit is it has less animal fat in it, and that saturated fat sticks to our arteries and blood vessels, which we don't want. There is an exception, however, and that's called palm oil, and we'll come to that in a bit. But palm oil is a vegetarian source of oil, but it's a saturated fat, so it's a bit of a trick there. A vegetarian diet's higher in fibre, and a few studies recently have found that vegetarians are less likely to develop heart disease, diabetes, high blood pressure, diverticular disease, and gallstones as well. Also less likely to develop bowel cancer, and I'm guessing that that's probably because of the level of fibre in their diet. So fibre is quite protective against bowel cancer, and we'll talk all about that in the fibre section. And also a reduced incidence of obesity. The disadvantages is it's a little bit harder to get your protein. your biological value protein, which often is in your meat products, and also some vegetarians can be a little bit deficient in iron, also zinc, B12 and calcium if you're vegan. So basically the recommendations are eating a wide variety of plant foods if you are vegetarian, including legumes, nuts, seeds, cereals and eggs if you choose to eat eggs. Eating enough iron containing foods, so lentils, legumes, green leafy veggies, grainy breads, breakfast cereals, so those fortified with iron such as your Weet-Bix is pretty good. And eating iron foods with vitamin C as well. So, you know, they say the old half a glass of orange juice with a meat containing meal, and that helps to absorb that. It's called non-heme iron, which is present in veggies, so your vegetable proteins, as opposed to your heme iron, which is in your meats. Okay, so that's things like citrus fruits, juices, tomatoes, capsicum, anything like that on or around your plate whilst you're eating can help absorb that iron because of the vitamin C. Vegans do avoid all animal foods, so we're reliant on getting our calcium from the soy products and other alternatives. So the recommended calcium serves, don't forget, are 3 per day. So we'll talk about that in the dairy section, but if you are a vegan, then in that section it's important getting enough soy and things. And if it's inadequate, consider supplementation. But before starting any supplement, making sure you speak to your doctor first. And the final question in this section, warfarin. So many patients with heart disease are on warfarin, and warfarin often comes with a warning that you need to be careful about vitamin K. So often I'll get a referral to a patient who is allergic to all green leafy vegetables. And then I go there and I have a look, and actually the patient's just being quite careful of the vitamin K because they're on warfarin. So I just want to clear that up for you here so that you've got that information as well. So what warfarin is it's a blood thinning medication. So it helps us treat and prevent blood clots within our arteries and blood vessels. Vitamin K is the opposite. It's essential in helping to make blood clots. Now, that's great because if we cut ourselves, then the vitamin K is what helps to, you know, create that clot so that we don't bleed out all over the place. So it's a fine balance. So too much vitamin K from our diet can reduce that effectiveness of warfarin by meaning that it doesn't stop as many, it doesn't thin our blood as much. So you don't need to get too caught up in this, but some food sources of vitamin K include things like alfalfa sprouts, avocado, asparagus, broccoli. So you're getting a green vibe here, a lot of green things. Brussels sprouts, cabbage, coriander, so some of our herbs, cauliflower, that type of thing, parsley, spinach as well. So the main point of this is that there's no need to avoid these foods. It's just that we don't want to have none one day and a huge amount the next, simply because it messes with our INR levels, so our clotting. So what we want to try and do is have moderate serves of around 2 to 4 tablespoons per meal for your lunch and dinner, and that's absolutely fine. So the people that run into problems here are those with, say, a beautiful veggie garden or have, you know, spinach, and one day the spinach is just little and you're watering it, and the next day it's huge and bushy and it's all ready. And then you're having spinach for dinner, spinach pie, spinach soup, and then suddenly you're getting a whole lot of vitamin K. So it's just something to keep in mind.